I'm Charlie Rardin. I'm a member of the Division of Urogynecology at Women and Infants Hospital and the Alpert Medical School of Brown University. This presentation is based on the publication entitled The Patient Perspective on Overactive Bladder, a Mixed Methods Needs Assessment, published in the journal BMC Family Practice in May 2014 by Frank Filipetto et al. This study was funded by an independent educational grant from Astellas. Pfizer Inc. provided funding for this presentation, which is not intended to be offered for credit for continuing medical education. Overactive bladder, or OAB, is characterized by urinary urgency, usually with frequency and nocturia, with or without urgency urinary incontinence. With the aging of the U.S. population, an increasing number of individuals are anticipated to be affected by OAB. Unfortunately, many patients with OAB are undertreated and experience persistent urinary and bladder symptoms. This survey was conducted to better understand the patient perspective on OAB, including knowledge, attitude, and patient experiences. A mixed methods qualitative-quantitative needs assessment was conducted to gain patient perspectives on OAB. 40 qualitative interviews were conducted by telephone with individuals who were pre-screened for history of OAB and/or urinary incontinence. Responses to these in-depth interviews provided the basis for development of the online survey. The online survey instrument included 27 questions. Individuals from the Research Now database who self-identified as having symptoms of OAB or bladder dysfunction were contacted by email to participate in the online survey. Participants were eligible to participate if they experienced symptoms of urgency, frequency, leakage, and/or urinary incontinence. The survey consisted of two components, focusing on participant experience and knowledge and attitudes related to OAB. In-depth qualitative interviews were conducted with 40 individuals, 31 women and 9 men. The individuals interviewed ranged in age from 40 to 80 years with an average of 63 years and had experienced 3 to 15 years of bladder or urinary symptoms. 200 online surveys were completed. The survey respondents were from 37 states in the United States. 51% were men. The survey population represented diverse ages. 33% were from 41 to 60 years, and 67% were of 61 years of age or older. Survey participants demonstrated a relatively high level of knowledge about OAB, with a 65% correct response rate to 6 knowledge-based questions on the survey. Female respondents and individuals who saw female physicians scored higher on knowledge questions compared with male respondents and respondents who saw male physicians. Respondents who saw urogynecologists or obstetrician-gynecologists had higher knowledge scores compared with those patients who reported seeing primary care physicians, urologists, or other physicians. However, this result should be interpreted with caution due to the small sample size. 66% of respondents disagreed with the statement, "OAB is just part of aging, I just have to live with it." On average, survey respondents had experienced urinary and bladder symptoms for 9 years, yet had only been under a physician's care for their symptoms for 5.8 years, translating into, on average, a 3.5-year gap between symptom onset and treatment initiation. Survey respondents reported common OAB symptoms such as urgency, frequency, nocturia, and leakage, and indicated that the condition had a significant impact on daily life. Self-management of OAB was common among the survey respondents. Approaches included using pads, restricting fluids, bathroom mapping, and restricting travel to short trips. During in-depth interviews, patients indicated that it can be embarrassing to bring up the topic of urinary or bladder-related symptoms with their doctors. Survey results indicated that only 14% of healthcare providers asked survey participants about urinary or bladder symptoms. 42% of respondents raised the issue of urinary or bladder symptoms while seeing a physician for an unrelated concern. When asked about assessments and evaluations conducted for their bladder and urinary symptoms, 56% of survey respondents identified they had urinalysis performed, 44% had a physical examination, vagina or prostate, and 40% had a bladder emptying test. When asked about the management of their OAB symptoms, 62% of survey respondents indicated that they had medications recommended or prescribed by their healthcare provider. Non-pharmacological strategies were less frequently recommended or offered. 29% and 31% of survey participants reported being provided bladder training and pelvic floor exercises, respectively. 31% of survey respondents indicated that it was very important to treat their urinary or bladder symptoms compared with other medical conditions. Most survey respondents indicated moderate treatment satisfaction with current treatment regimens, with 9% being very satisfied with their current treatments for OAB. Survey participants were asked to rate their initial and current urinary or bladder symptoms using a Likert scale ranging from not bothered to very bothered. Overall, results demonstrated essentially no change in symptom severity between symptom onset to current date. When asked about the frequency of discussions about OAB, urinary or bladder symptoms, with healthcare providers, 32% of survey respondents indicated that they had had such discussions on nearly every visit, and 41% discussed OAB symptoms with providers only occasionally. In contrast, 75% of those surveyed felt that it was very important to have regular discussions with their physicians about their symptoms. 57% of participants surveyed received no education materials from their healthcare providers about OAB, and 37% received printed materials. Limitations to this study should be noted. The online survey was developed based on responses from pilot interviews. The survey was not pilot tested nor validated. The survey population consisted of individuals that had self-identified as having symptoms of OAB or bladder dysfunction. A formal diagnosis by a healthcare provider was not required. The survey population may not reflect the perspective of all patients with OAB. In addition, the International Continence Society OAB definition was not used in this survey. Analysis of patient satisfaction was not stratified by either medications taken or behavioral intervention. Therefore, the impact of these treatment modalities is unclear. This needs assessment provided insights from the patient perspective on OAB and illuminated practice gaps related to communication, timely diagnosis, evaluation, treatment, long-term follow-up, and education. The online survey population reported a significant gap between the onset of their urinary or bladder symptoms and treatment initiation, with an average of 3.5 years for survey respondents. Less than 15% of those surveyed indicated that their healthcare providers had inquired about urinary or bladder symptoms, which suggests that proactive communication with these patients about these symptoms may help to reduce the gap between the symptom onset and diagnosis. Although most survey participants reported moderate satisfaction, current approaches are not making a difference in symptom severity, highlighting an important opportunity to improve outcomes for this patient population. However, it is important to note that this is a small survey that was not designed to support rigorous statements about treatments. There is a need for improved communication between providers and patients about their bladder and urinary symptoms, and opportunities to provide greater educational resources to patients about OAB.